Hey everyone, thanks for tuning in and welcome back to Effective Exercise. Stephen here with Team Euphoric, and today I'm going to be discussing how both practitioners and patients can optimize their health and performance by going over the CHEK Totem Pole. The first item at the top of the CHEK Totem Pole is respiration. Breathing is the foundation of life and the most critical function for survival. Proper respiration affects oxygen delivery, energy production, and overall cellular function. Poor breathing patterns can lead to issues like fatigue, anxiety, and impaired physical performance. That's why addressing breathing mechanics is crucial for any health or fitness program. Now I'm going to be going over some ways in which you can assess respiration. The first is going to be to take a look at their actual breathing rate. The breathing rate is how many inhalation and exhalation someone takes within a minute. Normal breathing rate is going to be anywhere between 12 to 16 breaths per minute. However, the ideal breathing rate is going to be anywhere between 6 to 10 breaths per minute. That is going to be when somebody is resting. This obviously is not going to occur when somebody is doing vigorous exercise. Once you've actually assessed their breathing rate, the next thing that you can take a look at is their actual breathing pattern. Most people are going to have an inverted breathing pattern, meaning they are going to be breathing in the opposite way in which they are intended to breathe, and they're going to breathe through their chest and shrug up with their shoulders. An ideal breathing pattern should start in the belly. So on the inhalation, the first 2/3 of the breath, the belly should expand. And then on the last third, you should see some expansion of the chest. And then on the exhalation, you're going to see the opposite. The first third, the chest is going to collapse. And then on the last 2/3 of the exhalation, the belly is going to collapse. So what you can do is just place one hand on the patient's chest, one hand on the belly, ask them to breathe, and see if they have a normal breathing pattern. The other problem is that most people are going to breathe in 2D when they should be breathing in 3D. What do I mean by that? Well, most people, they're only going to be breathing front to back, but ideally, when you are breathing, there should be some lateral expansion of the rib cage and some vertical elevation of the shoulders. So on the inhalation, the first 2/3, the belly expands, the last third, the chest expands. There should also be some expansion of the rib cage and then expansion of the shoulders. And then on the first third of the exhalation, the shoulders are going to come down, the chest and the abdominal cavity is going to collapse, and then the rib cage is going to collapse, and then on the last 2/3, the abdominal cavity is going to collapse. So you can place one hand on the chest, one hand on the belly, ask them to breathe, then ask them to breathe by placing two hands on the ribs, see if you get any of that lateral expansion. And then lastly, place a couple hands on the trapezius muscle, ask them to breathe, and see if there's any vertical expansion. Those are just a couple of ways in which you could assess somebody's respiration. I'm not going to go over every single way because that would take way too long for this video. However, if you are a channel member, then check out the assessment series playlist. I have 120 different assessment videos in that playlist. And if you are not a channel member, consider becoming a member for $5 a month and you'll have instant access to all of those videos. Now that we have actually discussed the assessment of respiration, we're going to go over some exercises. With regard to the exercises, both of these are going to be done in supine position, so you're going to be laying down in your back. And with regard to the first one, this is an awareness exercise. It is diaphragm awareness, and what you're doing is when you are on your back, you want to take an empty water bottle. You are going to place it on your umbilicus or your belly button, and then you want to inhale and try and bring the water bottle as high to the ceiling as you can. And then you're going to exhale and try and have it sink down as close to the spine as you can. So you're inhaling, raising it up, exhaling, letting it sink down. That is the diaphragm awareness exercise. To strengthen the diaphragm, we are going to need a kettlebell or a dumbbell. I'm going to be using a kettlebell.
For this one right over here, the setup position is going to be exactly the same. You are in that supine position. You're going to take the kettlebell, place it on your umbilicus or your belly button, and then you are going to inhale and drive the kettlebell up toward the sky. And then exhale and let it sink deep toward the spine. So you're inhaling, letting it go up toward the sky, exhaling, letting the belly sink, and trying to get the kettlebell as close to the spine as possible. The last exercise that you can do is box breathing. For box breathing, you're going to inhale for a count of 4 seconds. After you finish inhaling and getting that maximum breath in through the belly, you're going to hold it for 4 seconds. Then you're going to exhale for 4 seconds. And once you have completely let out the entire breath and you've fully exhaled, you're going to hold that position for 4 seconds. Those are just a few exercises that you can incorporate. I'm not going to go over all of them. However, regardless of whether you are a channel member or not, check out my exercise series playlist. I have over 700 different exercise videos that you can check out, and many of them pertain to breathing. But we're going to move on to the next item on the totem pole.
Thanks for sticking around until the end of the video. Be sure to like, share, and leave a comment as it'll help the algorithm. And if you enjoyed the content, show your support by subscribing to the channel by clicking on the icon in the bottom right corner. And if you really want to show your support, then consider becoming a member by clicking on the icon in the bottom left corner. These new high-quality videos aren't cheap to edit, and the $5 membership will really help with the video editing budget. You'll also get access to a ton of exclusive perks like early access to videos and this program design lecture playlist in the top right-hand corner. And if you want to learn how to do a one-armed pull-up, then check out the playlist on the top left corner.